Good evening to all our distinguished guests tonight. Ladies and gentlemen, my name is Jeanette Tembakau. Some of you know me. I'm the co-founder of Jari Jari Spa, a wellness center, and also the president of the Malaysia Spa Association. I am pleased to be with you tonight, and it is very special excitement that I have a chance to introduce Dr. Biswarup Roy Chowdhury. He is an author on reversing diabetes with plant-based food, and his mission is to educate and train people and other lifestyle-related disease through diet and nutrition. He is currently the trainer with dynamic memory, and he is also a medical nutritionist with consultancy medical training clinic in UK, Vietnam, Singapore, UAE, Bangladesh, Hong Kong, Switzerland, and many other places. His name is featured in the New York Times, BBC, The Telegram, CCN, The Washington Post, The Guardian, for his passion for human excellence. Why? Because he has helped thousands of people worldwide in reversing diabetes, and we are all in for a treat today. Without further ado, please join me in welcoming Dr. Biswarup Roy Chowdhury.
Good evening, friends. I am waiting, Janet is waiting, you are waiting. When the lecture will start? It took about 5 minutes. Everything is done. Now the lecture starts. This is what is diabetes, if it happens in human body. Let's try to understand how. For those people, if we talk, the diabetes type 2, what we call, their body produces same amount of insulin, the diabetes patient, as those who are non-diabetes. Try to understand. But the only difference is the lag of time. The production time of insulin is delayed. This means the sugar has to wait in the blood for longer time, which we call as high blood sugar. Right? So this means the brain is not able to give the signal to the pancreas at the right time. If that is so, it can be easily corrected. It can be easily corrected. But fortunately or unfortunately, in correcting this lag of time, the medicine has no role to play. So when somebody says medicine can control diabetes, no, it cannot. If that is true, then why we are increasing the dosage? Once you go back home, before you take the next medicine of diabetes, of blood pressure, of cholesterol, even blood thinner, you have to ask yourself one question. When you take medicine, it goes in the stomach, it added to the blood. Now, what exactly it is doing in the blood, in the body? If you don't know that, what it is doing in the body, then you should not take the medicine. Do you think when you take the diabetes pill, it takes the sugar out of the blood and throws it out of the body? It cannot. So, when you take the diabetes medicine, the blood sugar comes down. This means blood sugar comes down. This means sugar in the blood comes down. So where the sugar vanishes. To answer this question, I'll give you one example, and that example will make you understand what exactly happens inside the body when you take a medicine which is responsible to lower your blood sugar. Any kind of medicine. I'll give you one example to make you understand how the medicine works in the body. Now, my luggage, and a question to you, that it is full, right? And there is a small compartment outside which is having little space, but the inside that is totally full. If I ask you that I still have some more clothes to put inside, this much clothes, anybody who can help me put this cloth in the remaining compartment of this luggage? Now, in this compartment, you have to put this. It seems to be a little big, the compartment is a little small, but we can really try to squeeze it, right? And force it to be inside. And if the three of us try to push it and squeeze it, force it fully, surely it can go inside, right? However, the condition of the clothes, that is that is the question mark, but surely we can stuff it inside. And successfully, we have already done it to a great extent. The chain, it is almost going to be torn, but still we try to manage. Yeah. Done. It's gone inside. Great. Now, okay, you have to still wait, because I have some more. Now, if I ask you, oh, I forgot, this is some more material which you have to put, what would be your answer? After putting a lot of pressure on this, now you have understood that it is not possible to put some more things, right? And still if you try, this luggage or the material will get torn or something, right? So maybe they will refuse, right? But then I will put the question to the audience. Anyone who can really help me in pushing this inside, maybe nobody will raise hand. Then I will say, okay, I will give you some gift, some money, right? So, something, a reward. Maybe somebody may try, say, okay, I will. Anybody? Right. So, what will happen? They will push further, put more force, and try to put. Right? And maybe somebody will be successful. So, here, that is how the medicine works. Whenever you go for the first time to the doctor with the diagnosed with the diabetes, the first line of action, the medicine is, let's say, metformin. So, what it does, any medicine including metformin, thank you. Any medicine including metformin, what it does, it takes the sugar from the blood and it stuffs the sugar inside the heart, right, inside the kidney, right? And it keeps on doing for some time in the same way as they did metformin. But after a certain stage, that metformin is no more able to stuff the sugar in some part of the body. It is already full of its capacity. Now, when you go to the doctor understands the metformin is now unable to do, so he gives a different kind of medication, right? And that medication, the second line of action medication, is stronger than metformin, having a different kind of action, and that will help for certain more time to push some more sugar and stuff it inside the body, even if the body is already full of sugar, right? So, and after some time, maybe even the second line of action medicine, then the multiple kind of medicine will work. But maybe we keep on doing for 10 years, and a point will come when then all the medicine together is not helping you to bring the sugar down. At this point, what will happen? What you do? What the doctor will do? Anybody?
Insulin.
Insulin. Now, the doctor will say that medicine stopped working, right? In the same way as you said that now I cannot push anymore. So the doctor will ask you, prescribe you the insulin, different kind of insulin. And when you take insulin, you are surprised, it will quickly bring the blood sugar down, right? But what exactly happens when you take insulin? What exactly happens inside the body when you push insulin inside? That is very, very interesting to know. And once you know it, you will be discouraged, right? And you will not dare to use insulin again in your life. If you are a diabetes patient, you must eat lot of sweet fruits, especially mangoes, lot of bananas. So step 1 till 12 known only fruits and fruits, but how much is very, very important. How much? These 700 grams of fruits for me, 700 grams. So those who are highly sick people, you start with reading these books, number 1. Number 2, once you enhance your knowledge, then you should start this diet under the supervision, right? Supervision. This means you can be under my supervision, because these conventional doctors, they will not understand what your body needs.
Diabetes free.